my name is Casey Ryan, and this is my demonstration speech on how to tape an ankle. As the track runner takes the last corner of his race a little too sharp, he feels a sting of pain in his lower leg, leaving him on the ground and unable to finish his race. This athlete is suffering an ankle sprain, and until further evaluation, he will not know how much damage has occurred and how long he will be out of play. When looking at ankle tape jobs, they are crucial for getting athletes back into play and stabilizing them while they are newly returning to play. But before I show you how to tape an ankle, I'm going to go over some anatomy that will help you understand what goes into an ankle tape job and an ankle sprain. So first, we're going to look at the lateral ligaments of the ankle, or the outside of the ankle. So this is your heel, and this will be your toes. So we're not going to focus on this one, but I want you to focus on these three, which kind of make up a T formation. The first one right here is called your ATF, or your anterior talofibular ligament. The one that goes straight down here is called your CFL, which is your calcaneal fibular ligament, and the one going straight back is your PTF, which is your posterior talofibular ligament. Now, on the medial or inside of your ankle, you have a group of ligaments called the deltoid ligaments, and those are rarely damaged unless you fracture your ankle or dislocate it. Now, going back to the lateral ligaments, there are 3 different degrees or grades of an ankle sprain. The first degree is where you only damage your ATF, which is right there. The second degree is where you damage your ATF and your CFL. The third degree is where you injure all 3 of them, so your ATF, CFL, and PTF, and that is a result of an ankle fracture or an ankle dislocation. Some of the other bones that I would like to point out that are important when you are taping an ankle are your malleoluses. So you have a medial malleolus and a lateral malleolus, and those are just like the bony knobs or your ankle bones. And the other bone I would like to point out is the base of your 5th metatarsal. So your pinky toe is the base of your 5th metatarsal. You're going to follow that all the way down until it kind of indents right here. You'll be able to feel that. You do not want to put anything directly on this point because too much pressure will make the tape job very uncomfortable for the athlete. So, when looking at a sprained ankle, I'm going to talk about the mechanism or how the ankle is placed when it is damaged. So normally, the ankle is plantar flexed or pointed down and inverted, so all the way towards the inside of your body. This stretches all of your ligaments, and they're easily damaged from there. So when we tape an ankle, we want to bring the foot into dorsiflexion, which is the opposite of plantar flexion, and eversion, which is the opposite of inversion. So now I'm going to tape an ankle. Okay, so starting off a tape job, you want to use pre-wrap, because in this case, hairy legs and tape do not go well together. So you're going to pre-wrap from the base of the calf, wrapping the pre-wrap all the way around the foot and ankle, going to the arch. So you want to fill in all of this space so there's no skin that is exposed. Pre-wrap is not necessary, but it is helpful if they do not shave their legs or if they are sensitive to tape chemicals or any of the other sprays that we might use during a tape job. So to start off, we are going to do 2 anchors up on the base of the calf. This just is so that you have a point to start your stirrups and end your stirrups. So we do one, and then we overlap the second one by half. Tear the tape each time. So then you're going to go down to the arch of the foot, find that base of the 5th, and go directly under it, making an anchor, like so. Ripping that. Next, we are going to do 3 stirrups, alternating with horseshoes. Stirrups help bring the foot into eversion, which is a major part of the tape job. So you're going to start your stirrup on the medial side and on your anchor. You're going to go over your medial malleolus, bring it around the foot and to the back anchor. You're going to tear it and crank the foot into eversion and lay it down like so. Then your horseshoe basically just goes over the tape job medial to lateral so that the horseshoes or the stirrups stay in place. So you're going to do that 2 more times. So from the medial anchor over the malleolus back to the lateral. You're going to do another horseshoe, overlapping by half, and one last stirrup. Like so. So now that we're done with our stirrups and our horseshoes, we're just going to fill in the rest of the space that is open. So we have a clean slate for our figure eights and our heel locks. Okay, so now we are going to do our heel locks, or our figure eights actually. So you're going to start in the lateral malleolus. You're going to bring the tape around the back or the Achilles tendon and then back to the front, around the arch, and back to the Achilles tendon. You're going to continue that twice and end up by the calf. So those are your figure eights. Next you're going to do your heel locks, which start on the medial malleolus. You're going to bring it again around the Achilles tendon to the heel, around the arch, back up top, and around the Achilles again. So you're going to go Achilles, heel, arch, around top, Achilles, heel, arch. And you're going to finish at the base of the calf, or up top. So those are your heel locks and your figure eights. These are what completely stabilize the ankle when they are running or going from side to side. So the more heel locks you do, the more stable they are. And oftentimes with a larger degree of a sprain, you're going to do more stirrups and heel locks, which sacrifices mobility for stability. So once we're done with those, I'm going to do one last anchor on the bottom to kind of close up the loose ends. And I'm going to close up on the top to again close up the loose ends. And do one more anchor right up top. And that is how you tape an ankle. So, I believe that ankle tape jobs are more effective than braces are because you are able to customize them for each person and injury, and you are able to make it fit more comfortably for the athlete. So that is how you tape an ankle. Thank you.